Cloudcast Media.
I'm Drew Schlossberg of Cloudcast Media, and we are so pleased to have back on the air our friends from the San Diego American Indian Health Center. Joining us is Kevin LaChapelle. He is the CEO. Kevin, how you doing?
Very good. Thank you for having us.
Of course, we always like to have you on. You got some great content for our listeners and so forth, and be remiss in the world you're in to ask, man, how are you folks handling all this craziness with Omicron and son of Omicron and who knows what's down the list, right?
Oh, so true. And actually, our team has done amazingly well. They've been doing just incredible. We've actually had not as much turnover as many other organizations have had. And so when this happened, I'll never forget it because it was on my birthday on a Monday and when it first started, and got that call from the state. Right. So we met with our staff, and everyone agreed and said, you know what, let's hunker down and do everything we can to serve the community. And so we've kind of let that guide us, and it's been really, really powerful. And it's been life-changing for our organization as well.
Yeah.
We've learned a lot of things about us that we couldn't see before because we've never been through this.
Right. No, I think that's great. And of course, the organization's been around since 1979, and you've been there since October of 2019, right before the pandemic. Yes. So what's the core mission of the center?
Our mission, we really are trying to promote excellence in healthcare with respect to custom and tradition with our Native American focus. And our goal is reducing the significant health disparities of San Diego's urban American Indians and also underserved populations. And we do this through improving the excellence of care and really resulting in increased life expectancy and improved quality of life. So we're really into that population health and doing everything we can to support our patients to manage disease and things like that. We have full service medical, dental, and behavioral health, and we have a great wellness program as well. And we also have a youth program. So we've got some great programs here.
Yeah, it looks like it's very comprehensive. So do you focus mainly on the urban core, the folks that are in the city? Do you go out to the rural areas? And you had mentioned that you also work with underserved groups. And can they be outside the Native American space?
Yeah, so our focus is urban Native Americans,
Gotcha.
Not the rural areas. And then about a third of our patients are Native American, and then the remainder are low-income, underserved populations. And so we are able to serve a large number of people that really need the help, and we're so excited to be able to be there for them.
Right. Where are you folks located?
We're located down at Bankers Hill, right off of First and Maple.
Right. Yeah, I know exactly where that is. And do you have satellite offices or centers at all?
We have 2 mobile outreach vans that we were able to do through COVID.
Right.
So we actually, do go mobile and things like that. We're also working on a new building that'll be on our same property. That's going to be great because it's going to offer a lot more things in women's health, pediatrics, and urgent care. And we'll look at also possibly a pharmacy. So we're excited for those things. Help us grow.
Yeah, no, that's that's terrific. One of the things you had noted, of course, is that certainly in the Native American culture, so much respect for the elders and seniors and all that business, but they've really grasped what you've been done and certainly been a great support, have they not?
It's been really awesome because we partnered with them. So, for example, because of the historical trauma that the Native Americans have been through.
Right.
There was concern of reluctancy for vaccinations and so forth, but we had many elders do videos and board members do videos while they got their vaccine to really encourage people. So we actually had a lot of people to receive vaccines, and we had a huge focus on not only the vaccines, but also testing and also providing outreach services for people that couldn't get out of their homes. So some of that was delivering food to our elders and then working to, virtually through telehealth, manage disease and provide educational programming and things like that, diabetes, hypertension, even cooking classes, all throughout COVID. So it actually really was very synergistic and just sparked a lot of great things.
Right. So was this a population? We're chatting with Kevin LaChapelle. He is the CEO of the San Diego American Indian Health Center. I'm Drew Schlossberg of Cloudcast Media. As you're listening to another edition of Spotlight on the Community. Yeah. So traditionally, even before you folks, ramp this up, obviously with COVID, would this population probably not be, wanting to get vaccines and boosters, as you had mentioned before, just because of the history? So that was a very real thing, and I'm sure you got some numbers on a success rate that now, since you folks have been really pushing this out, a good percentage of them have been vaccinated, correct?
Yes, we started off, we wanted to make a commitment that we were not going to pressure people to get vaccinated. We wanted to just give them the factual information,
right,
and really show them that there is so much more risk in not getting vaccinated than there is in actually getting vaccinated. And so we partnered with people, and we had discussions. Some people were reluctant for a little while. And then after people like Randy Edmonds, who's a very well-known elder, posted on Facebook him receiving his vaccine, and people started understanding things and saying, you know what, we really need to do this to help each other stay safe. And so we started really getting a lot of good numbers from that. And then also with the testing, we did a lot of testing. But we had some events where we had hundreds of people show up. So it was really great.
Nice. How have the young folks embraced this?
I think, definitely the elders, I think, were very, very worried because they knew they were an at-risk population because of age.
Right.
Definitely there was young people feeling that, hey, I think I can get through this. I don't think I need the vaccine. But we did a big campaign talking about when you are in the home, you're putting others at risk because of you're not getting vaccinated. And that worked very well. People kind of started getting that. We have talking circles and things. So what I love about Native American culture is they're very good at having dialogue to help set things, get the facts out there so that people can really start understanding things. And I believe that we're better off when people make the decision on their own, because they're more prone to also help other people around them understand the importance of this as well.
Yeah, spot on. We need to take some of that Native American culture they've been doing for centuries and infuse it with our general population, for God's sake.
Yes.
That would, I think, would be very, very good without any question whatsoever. In general, let's put COVID aside for a second, which is almost impossible, of course. But in general, what are some of the challenges that the Native American, culture in health hits with them? Is it, you mentioned obesity? Is it that? Is it other areas that are just, general, little more of a concern with that culture?
Well, there's definitely diabetes, hypertension.
Right.
Obesity, COPD,
right,
and so for us, we really want to, and what our focus is to partner with them in their care.
Right.
So again, we want to help them understand if there's some lifestyle changes, you can look forward to a lifestyle like this rather than this.
Right.
And we've got great partners. We had American Heart Association partner with us and give us 500 blood pressure monitoring so people could monitor their blood pressure. And we've had other grants that have helped us with the diabetes monitoring and things too. So, the other thing we try to do is destigmatize disease. Sometimes people feel like, since I have this, people look at me like, well, why do you have this? Why didn't you take better care of yourself or whatever?
Right.
And so we really have this focus of we're all in this together. Even community members around the clinic have started coming to the clinic, and they really appreciate the Native American focus that we have because, as you stated earlier, they see a lot of value in Native American tradition.
Oh, yeah, without question. And I think a lot of people can certainly benefit from that as well. Kevin, much has been chatted about, even before COVID, of the mental health crisis, I should say, that we've been under this country for quite a while now, just exasperated by COVID, to say the least. I'm sure it's no different in the Native American group as well.
Yes, and it's interesting because we recognized even more so with COVID, our behavioral health, nearly doubled because people were under such stress. And
right.
So the anxiety, the depression, all of the different things. So we actually started doing teletherapy. And we did a lot of data analytics and really looking and understanding what our patients were going through. But the other thing that we did is we've really worked hard to integrate behavioral health, medical, and dental. So, for example, if dental is seeing a patient and they sense that the patient's sharing that they have some needs behavioral health wise, we are really getting good at doing referrals internally to where we hand them off to behavioral health so that we can be a support for them, and the same for medical. And so I think those things, and also again, destigmatizing the need for behavioral health services, because just like you see with PTSD with veterans, we have to destigmatize a lot of these things to let
Right.
people know that everybody has issues. There's nobody that is just free from everything, and so it doesn't mean that we're weaker. It means that at this time of our life, we need to get some support, and then we want to position ourselves to help provide that support.
Well, you're spot on, and we can't say it enough here. A lot of the guests we have on our Spotlight on the Community show, Kevin, are in the space of mental health, of course, and health in general. It's a frequent refrain of, it just makes me shake my head, and I'm sure you, since you're a professional in the field, when people still in the 21st century think there's something wrong about some mental health issues, and you don't say that about somebody, who broke an arm is wearing a cast. They broke their arm, they're wearing a cast, all right? So,
That's right.
So example, you guys know this and talk about it, and I think the more we're out there saying, no, you know what, that's what it is, and we're going to get some help and recognize it, and no different than breaking a leg or spraining an ankle or whatever the case may be. Do you think we're making some progress in that area?
I do actually think so. I do think that, and some of this I think was precipitated by COVID,
Right?
Because COVID has caused many, many people to have deep reflection on their life, their time with family, and priorities and things. So we've actually tried to use that as an opportunity to speak about things like this that we knew would hit a sweet spot because we saw what people were feeling. And we just had great luck with talking circles and things like that, elders meetings and them dialoguing and having discussions, Cedar Branch meeting that helps us understand our community and be able to position ourselves to provide the needs the best we can. So having that dialogue where we're not talking about it as, oh, something's wrong with you, it's more of understanding what are some things that all of us are going through at different levels, of course. But so we look at behavioral health needs no different than hypertension, because they're all connected. If we have stress going on, it's going to obviously contribute to hypertension and other things. So we try to look at it as a holistic approach. And we're fortunate to have a lot of patients that are very willing to share in talking circles and things so that they become a support system for each other. And then we have staff that also have been through different issues in their own lives. And so I noticed that our staff they're really able to connect with people, because instead of coming at it as, we're here because you have issues, we're saying we're in this business because we too have encountered some of these things. And so we want to all do this together. And I think that's been one of the most powerful things that I've seen through COVID that did significantly change from before COVID.
Right. Yeah. Can you shout out your website so people can find out more about what you're doing?
So our website is www.sdaihc.org, and you'll have information for Dr. Richardson's dental program, Dr. Baker and Katie Perry and Rebecca Villalobos, who run our medical, do an amazing job. We have nurse practitioners there. We also, in behavioral health, Dr. Clement. We also have psychiatric nurse practitioners. And again, we have a wellness program. We have an HIV program. So we have a lot of programs, and they're all featured on the website. Everything's up to date. So we encourage people to go there and reach out to us anytime so we can be a support for them.
No, that sounds great. Kevin, when we come back from break, we're going to talk a little bit more about some of the health trends that are you're seeing among the American Indian communities and the concerns they have and so forth. And more importantly, what our listeners can do. We always set time in the second segment for you to shout out, we need help volunteering, we need donations, we need pick a topic, and that's it. And then, of course, I want to spend a few seconds talking about the powwow coming up in May as well. That's a very important event for for you when we return with Kevin LaChapelle. He is the CEO of the San Diego American Indian Health, chatting about all the cool things the center has been doing since 1979, how they've had to pivot like everybody else in this crazy COVID-19 world that doesn't seem to end, but somewhere down the road there's going to be an end. Hopefully we're around to see that, Kevin, and I'm confident we will. Talk a little bit about some of the health trends that you're seeing among American Indian communities.
Well, and I would first contrast this. You probably have heard in healthcare in general,
right.
Many healthcare systems are experiencing patients that are very difficult, they're saying, to deal with.
Yes.
We actually have not experienced that. It's really interesting what I've experienced from the Native American community. They've been so encouraging in telling us, thank you, we're grateful that you guys have been there for us, and stay strong, we're with you. It's been remarkable to have that kind of relationship with our patient population, especially when I hear on the news many times where other organizations, by far across the country, are seeing a lot of fatigue with patients. But I think the Native Americans handle things much differently. They've been through so much that they have that resilience, and it's passed on to our staff. And that's also passed on to other patients, the non-Native patients. So it's been really good. Some of the other trends are, though, that obviously disease management is very tough. And, even when we want to go with telehealth visits, there are times that we need to have people in person because of lab work and things like that. So we'll always have those challenges, but I think that we're adjusting quite well to a hybrid of being able to keep people safe. And then we've also let our patients be very transparent, letting them know what we're doing to keep the health center safe. And some of it is having the kiosks that take temperatures and things like that, asking those questions about symptoms, all those things, the cleaning, disinfecting constantly. The staff here has done a great job with that. We've actually seen an improvement in some of our measures of patients being more compliant. And I see that as they understand the importance now more than ever of being as healthy as you possibly can so that you can bounce back should you get COVID. And I think that's been a kind of a message that we've also tried to focus on because we think that's very important.
Well, not only that, and a subset of that is something you said earlier too, recognizing, listen, if I'm not being careful with my health, I'm going to impact somebody else, and especially an elder, heaven forbid, or something in that aspect of it. And they've really embraced it. And I'm so glad to hear that the Native American culture, the ones that you have been serving, have really embraced what you and your doctors and the staff and everybody is doing to support them. And you're 100% correct. A friend and colleague of mine happens to be the CEO of a major health organization, and they're not facing that. And as you said, you're 100% correct. And, they're almost a plea to people that come in and use, their system to, we're doing the best we can with a short staff, and everyone's trying to help everybody else. But it's amazing we actually have to say this, to adults, to be honest with you, but we do. And that's something that everyone can learn from what you folks are doing. Talk a little bit about the annual powwow.
Well, and to kind of segue into that powwow, I've worked in many different organizations in healthcare, and the team that we have here, I have never seen such a committed team that is very intrinsically driven and here for very deep reasons, especially their passion and love for our Native population and for underserved. And, the last powwow we had just recently, we had to skip before because of COVID,
right?
But we had ours in October, and it was, I would almost call it magical. It was amazing to see all the staff participation, the community coming out and really engaging with each other. It was incredible. Our board of directors is just amazingly strong. They're very committed to sponsoring the powwow every year. Our board obviously is very hands-on with our organization. They're very supportive for all of our team. They have great expertise. And so when the powwow comes up, they too are taking part in that. Randy Edmonds, our honorary chairman, one of the most amazing elders in the Native community, it takes a strong leadership role. This May will be there, May 14th and 15th, 10 a.m. to 6 p.m. And what I would encourage people, especially people that maybe have never come to a powwow, it's just phenomenal, because if you really want to see Native American culture, but also learn about the culture and why do they do some of the things that they do, and how special things are, from the regalia and how they put that together, and the significant meanings to their prayer for each other. It's really something that you can't even describe unless you attend. And I would encourage anyone to come. It's free. And when you come there, there's food, great food that you can always have with the different kiosks. And you also can see a lot of Native American jewelry and things like that. So we had such great feedback from the community. And I think part of it was because they hadn't had it for a while, so they missed it.
Right.
But it was just incredible how people came together, and standing together like that was very powerful. The dances, the Native American dances, incredible. And again, to understand the depth at which these things happen is very amazing. So we look forward to that. We also will have our health center. Obviously, we are the sponsors, so
Right.
we also have medical things set up there. So we'll be doing, we can do COVID tests, vaccines, just like we did in the last powwow. So we're there for everyone. We'll actually have a dental team doing some screenings. We'll have behavioral health also doing some screening, setting up appointments. Same with medical. So we kind of take everything and set up over there so we can be at our best for the thousands of people that attend this incredible event.
Right. We're chatting with Kevin LaChapelle. He's the CEO of the San Diego American Indian Health Center. I'm Drew Schlossberg of Cloudcast Media. As you're listening to another edition of Spotlight on the Community. The powwow is free, or am I wrong on that?
It is free.
Right.
So everyone's welcome to come, and you will not be you will not be disappointed. I can assure you of that.
Yeah, no, I think that's, I was trying to make it down one of the years before COVID and couldn't make it, and just heard nothing but wonderful things from the people I know that went to that. So I think that's a lot of fun, so forth, and we'll look forward. Hopefully I can bust free and get down there, and I'm not so sure I get my dancing shoes on, but I'll get my listening shoes on. How's that sound? Kevin, what can our listeners do to help support the mission and what you folks are doing at the center?
I would say right now, one of the biggest focuses would be our new building.
Right.
We're outgrowing the facility that we're in now. It's very old as well, but we also are outgrowing it. So if we have on our website, you can go to the About Us, and when you click on Board of Directors, you can see Future SDAIHC. And we would love anybody that can help, to have opportunities for, sponsoring one of the exam rooms or different equipment, providing much better services, having newer equipment, and also, again, having those specialties like women's health, pediatrics, and urgent care. So we encourage anyone that has ideas even to feel free to reach out. You can also go on our website to meet the team, and my email is on my little profile, and feel free to send me any kind of message, any questions you have, and we'll take good care of you.
No, that's great. What I'd love to do, if you're so willing and inclined, is next time you're on, and maybe we'll get you on maybe 3-4 weeks before the powwow day, shout that out. And if you can bring in, if you're willing, obviously you want to be careful of privacy rules here, but and HIPAA and all that, but if you want to bring in a family member or somebody who has benefited from the center's services, I think that's always a good thing to show the folks that this is what we're doing, and here's proof sitting right next to me.
Oh, we would love to do that. That'd be amazing. We do have families that have done that before with us, and it's always nice. We have a lot of, like our Cedar branch, where we have families that come and help us with guiding the direction of our health center, that the board takes that input. And so we always are excited to do things like that.
Good. Shoot me an email, or have, our good friends at Beckham and Hill shoot me a note, and then we'll get that on the calendar maybe a few weeks before the powwow in May.
That sounds great. Such a pleasure to be here with you, and thank you so much.
Well, Kevin, it's our pleasure. You always have some great content and doing wonderful things in the community, and we'll look forward to having you back on in a couple months.
Thank you so much.
You bet. We've been chatting with Kevin LaChapelle, CEO of the San Diego American Indian Health Center. I'm Drew Schlossberg of Cloudcast Media. You've been listening to another edition of Spotlight on the Community.